The impact of nurse-to-patient ratios on medical surgical units, patient outcomes, a critical examination. This is done by Christopher Hulsey, Bridget Joins, Kristen Maltzberger, Tiffany Seiler, and Lane Young. The topic covers, in modern healthcare settings, the designation of resources is a substantial determining factor when patient outcomes and quality of care are in question. While many factors that influence nursing effectiveness, nurse-to-patient ratios are critical factors of patient outcomes. Research indicates that increased nurse staffing levels correlate with reduced hospital readiness, I stand corrected, readmissions, shorter lengths of stay, and decreased mortality rates. The search strategy used databases such as Baylor, OneSearch, Google Scholar, and PubMed. The search focused on terms like staffing ratios and patient outcomes. 6 peer-reviewed journal articles from the previous decade were selected based on their relevance to the topic. The purpose of this paper is to synthesize the nursing research on the effect of higher nurse-to-patient ratios compared to lower nurse-to-patient ratios on outcomes for patients in medical surgical units.
Article 1, Nurses' Perceptions on the Effects of High Nursing Workload on Patient Care in an Intensive Care Unit of a Referral Hospital in Malawi, a qualitative study. This study uses a qualitative descriptive approach. In-depth interviews were used to collect all of the data needed. The sample setting. The study was conducted in an ICU unit at Queen Elizabeth Central Hospital in Blantyre, Malawi. The sample consisted of 12 nurses that worked in the ICU at this hospital full time. Data saturation was reached after 10 interviews. The study revealed that an increase in nursing workload impairs the ability of the nurse to deliver quality care to patients. The findings also show that due to the previous statement, the patient safety is compromised. Overall, these findings in the article show that nurses are aware of the negative effects that occur under the increased nursing workload. Findings suggest that there is a need for policy change to manage or reduce nursing workloads. Article 2, nurse staffing, nurses prioritization, missed care, quality of nursing care, and nurse outcomes. This study utilized cross-sectional surveys of nurses from medical or surgical units at Korean hospitals. 3 different surveys were conducted for nurse managers, registered nurses, and patients that examined relationships among nurse staffing and missed nursing care. The sample consists of 2,114 nurses from 156 medical or surgical units across 49 different hospitals in Korea. Nurse managers, nurses who had not participated in direct care, and nurses at 3 non-general hospitals were excluded from the sample. The study identified 24 activities that were considered essential nursing tasks. Of the 24 activities, nurses reported that 8.9 were missed on average. Among the most commonly missed activities were patient turning, patient bathing, ambulation, providing emotional support, and oral care. The study also showed that there was no clear relationship between perceived importance of an activity and whether or not it would be delayed by nurses. Lastly, it was discovered that there exists a relationship between nurse job satisfaction and missed nursing care that needs to be looked into more.
Article 3, the impact of California's staffing mandate and the economic recession on registered nurse staffing levels, a longitudinal analysis. So in the United States, California is the only state to enact a minimum nurse-to-patient ratio mandate. This study looks at the effects of this mandate on patient outcomes. For the research study, nurse staffing levels in California hospitals were compared to other state hospitals over a 20-year period from 1997 to 2016. Data on nurse hours per patient and nurse hour per patient day were examined. The data was collected from the American Hospital Association's annual survey historical data. An analysis of the impacts of this mandate shows that adequate staffing ratios not only improve patient outcomes, but they also improve the economic resilience of the hospital. After mandating a nurse-to-patient ratio of 1 to 5 in 2008, these hospitals spent more of their budget on nursing services, but this investment allowed for better patient outcomes in the long term. Article 4, Nurse Staffing and Patient Outcomes, a longitudinal study on trend and seasonality. For this research design, the study looked at nursing units from the National Database of Nursing Quality Indicators. These units were grouped and analyzed to look at the relationship between patient outcomes and staffing ratios using weighted linear mixed models. The study looked at unit-level nursing data from 2004 to 2012 in the National Database of Nursing Quality Indicators. The study found associations between nurse staffing and patient outcomes, including that higher staffing ratios were associated with fewer adverse patient events. And it also concluded that staffing ratios do make a difference for patient outcomes, but more research needs to be done to clarify the specific relationship between these two variables.
Article 5, Patient Outcomes and Cost Savings Associated with Hospital-Safe Nurse Staffing Legislation, which was an observational study. This was an observational study that looked at Medicare patient data, hospital characteristic data from the American Hospital Association, and a survey completed by registered nurses about nurse staffing ratios on medical surgical units. The sample consisted of patients who received Medicare, are age 65 years or older, and were admitted to one of 87 acute care hospitals in Illinois in 2018. Exclusion criteria included patients who stayed longer than 60 days and those admitted for psychological reasons or reasons related to drug and alcohol abuse. The study looked at 30-day mortality rates, length of hospital stays, and cost savings for hospitals in relation to nursing hours per patient and percentage of nursing hours provided by registered nurses. The conclusions of the study showed that if nurses and medical surgical units cared for no more than 4 patients each, thousands of deaths could be avoided, and patients would have shorter hospital stays, resulting in a reduction in hospital costs.
Article 6, Case for Hospital Nurse-Patient Ratio Legislation in Queensland, Australia Hospitals, an observational study. This study in Australia looked at 30-day mortality in relation to patient quality and safety indicators, indicating overall quality of care, confidence that discharged patients could care for themselves, and patient safety. They did this by analyzing data from nurse surveys and linked them to patient data. The study sampled patients and nurses from medical surgical floors in 68 public hospitals in Queensland. The results of this qualitative study revealed the addition of 1 patient per nurse was associated with increased odds of patient mortality. These findings indicate the potential benefit of lower nurse-to-patient ratios on patient outcomes. In summary, the available data indicates a clear necessity for reconsideration of nurse staffing ratios as a means to enhance patient outcomes. The implementation of staffing mandates could have the potential to increase recruitment and retention rates through the improvement of nursing staff satisfaction levels. California's prescribed ratios serve as an exemplary model highlighting legislative action that underscores the critically placed upon nurse advocacy. To ensure optimal effectiveness, evidence-based methodologies must dictate adjustments in staffing allocations based on both patients' individual acuity and unit-related factors under consideration. Research underlines the necessity altering staffing ratios to guarantee patient safety. Although hospitals adhering to demanded staffing ratios show enhanced results, crediting mandates autonomously still is a strenuous task. There is a critical need for added research aimed at figuring out ideal ratios within lower acuity environments and expanding upon factors that influence nurse contentment levels. The references are available below. Thank you for your time.